Hello everyone, and our next lesson is medication safety in older adults. This topic is very important, and we wanted to talk about safe medication use in older adults. It's one of the very hot topics and very important topics when we talk about older adults, especially that drugs act differently and require careful dosages and adjustments and monitoring in older adults. And the majority of the drugs are actually developed without involvement of older adults in the clinical trials. So they are not being involved in the research when we are doing the medication research. So that's why it's very important to be cautious and use them in a safe manner. Okay, there is also an increased interaction and increased risk for adverse reactions because older adults are more likely than others to be taking more than one medication. Sometimes they forget, sometimes they miss doses, and so they take them at the same time. Also, they have multiple comorbidities, by which multiple medications, and we'll talk about this again and again. There are multiple comorbidities in older adults, and also because of poor adherence and because of cognitive. So again, as I mentioned, most of the commonly used drugs are cardiovascular agents, antihypertensives, analgesics, antiarthritic agents, sedatives, laxatives, and antacids. These drugs can cause adverse effects such as confusion, dizziness, fall, fluid and electrolyte imbalances, as I mentioned, um, in terms of heart failure. In this table, you can see that there are multiple interactions among popular drugs. These drug groups by themselves that they can interact with each other. So, for example, antacids can decrease the effect of anticoagulants medication, and so on. Now let's talk about pharmacokinetics in detail. In terms of absorption, as we mentioned, pharmacokinetics involves absorption also. So with absorption, what happens in older adults that there is an increase in the gastric pH and there is also a decrease in the intracellular fluid. And with the decrease of gastric blood flow makes the medication absorption very slow, in addition to, of course, a decrease in the intestinal motility. Again, in terms of absorption, it depends on the route of administration. So, for example, some of the drugs that are given IM or sub-Q or orally or even rectally are not absorbed as efficiently as drugs that are inhaled, for example, or applied topically or instilled intravenously. So, an IV medication would be much more faster or efficient than taking them orally. In addition, when we talk about absorption, we also have to mention what we call the concentration and the solubility of the drug. So for drugs that are highly soluble, for example, the aqueous solutions, and the ones that are high in concentration are absorbed with greater speed than less soluble or less concentrated drugs. Okay, so this is very important. The other thing, that is in terms of disease symptoms, there are some conditions that affect the older adults' absorption of the medication. For example, hypokalemia can increase the absorption of drugs, whereas pain and mucosal edema will slow the absorption. In terms of distribution, it's very, very difficult to predict the drug distribution in an older adult. That's why we have to be very cautious and careful. So, as you know, distribution can be affected, sorry, because of the changes in terms of circulation, because there is slow circulation, there is less membrane permeability in older adult, body temperature can change, the tissue structure itself, the adipose tissue, for example, increases, and therefore the lipid soluble drugs will have increased tissue accumulation and longer duration in the body, so they don't get distributed very easily, such like in younger adults. In terms of metabolism or detoxification, there are multiple conditions that can decrease the metabolism and can result actually in drug toxicity or toxic levels of any medication. For example, dehydration, hyperthermia, immobility, and a lot of the liver diseases, especially liver diseases. So, for example, a decreased cardiac and renal function can extend also the biological half-life. So how much the drug stays in the body can be affected because of cardiac condition. Okay. For patients who have decreased liver function, such as those who have hepatic cirrhosis, for example, they will have a hepatic blood flow reduction by 45% between the age of 25 or 65 years. This is a common or a general manifestation that can be seen in older adults, but in patients with hepatitis, patients with liver cirrhosis, for example, it tends to be even more. So in terms of excretion, there is also a reduced efficiency of the kidneys with older adults, as you may know. So the excretion of any medication will be affected, of course, because the nephrons decrease in number, as we mentioned earlier in the renal lecture. Also, there is a reduction in the glomerular filtration rate and a reduction in the blood flow of the kidneys because of the cardiac issues, or a reduction in cardiac output. So as you see, there is a lot of alteration in the pharmacokinetic, but as also there is other alteration or altered pharmacodynamics in older adults. There is still, we still have limited information available about older adults because they are mostly not being involved in clinical trials, as I mentioned at the beginning of the lecture. So there is also differences about in terms of older adults, in terms of increase in myocardial sensitivity, for example, to anesthesia. There is also an increase in central nervous system receptor sensitivity to narcotics, for example, or to alcohol or to bromides, for example, and that's why the all these agents, they act differently or more. They can affect the older adult. The sedation, for example, or the narcotics can make them very sleepy, for example. It can affect them in a way that is different than the younger adults. Now, to promote the safe use of drugs, there is one criteria that I want you to refer for, which is Beers criteria, which can identify the drugs that carry the high risk for older adults. You can find this in a box in your textbook. Also, to promote the safe use of drugs, we need to always, when we receive our patient in the clinic or in the hospital, we need to review the necessity and the effectiveness of any prescribed medication. So we go through their medication list and see if it's necessary anymore or not. And believe me, you will find a lot of medications that are not necessary. We need also to ensure that oral medication achieves full benefit. Okay, we need to, for example, use medication that are enteric coated or the sustained release tablets need to be taken more effectively or ahead of time. Also, suppositories should be taken with cautious. In addition to intramuscular and subcutaneous administration of medication, such as in terms of enoxaparin, for example, we have to be cautious and promote the safe use of these medications or injections. So they have to be taught, or their caregiver have to be taught, for example, the mechanism of the action of enoxaparin and when to stop it if they bleed, for example, and when to refer to their healthcare. So this is the Beers criteria, and you can go through it. Again, to promote safe and effective use of drugs, we need to include certain things in our patient teaching. For example, we need to assess any risk for medication errors. So if the patient is having visual or sensory problems, we need to make sure that they can access their medication, can take their medication at the right time as prescribed. Also, we need to give detailed description of each medication and how they can use it effectively. There are many risk factors for medication errors. For example, the use of multiple medication, as we mentioned, the cognitive impairment, as I mentioned, visual deficits, hearing deficits, arthritis. If the patient is having arthritis, their ability to take their medication might be affected because they will be having weak hands. Also, if they have history of non-compliance with any medical regimen, also the lack of knowledge regarding the importance of any medication. So one story that I can tell you, that there was one patient that who didn't like furosemide, for example. It was heart failure, and he didn't like using furosemide because he cannot go around and visit his family because he will be going to the toilet very frequently, so he don't want to take furosemide because of that. And then he was admitted to the hospital because he was non-adhering to the medication because of a problem that happens to him. So he don't like the medication because of the effect of the medication. Now, we also, when we talk about safe medication use, we need to talk about alternatives to drugs. For example, lifestyle changes. So a modification in diet is very important. For example, to prevent constipation instead of continuing use of laxatives. For example, regular exercise is also important. Stress management, a regular schedule for sleep and rest, and elimination are very, very crucially important. It can also prevent the older adult from taking a lot of medications. Also, they can be any alternative or complementary therapies can replace some of these drugs. Let's talk about some of the bad practices here. Some of the patients, such as taking or giving incorrect dosage to themselves, so they do take the incorrect dosage. They can be non-compliant because of misunderstanding, or they can be non-compliant to the medication because of cognitive problems or because of the side effects. okay, or the action of the medication itself, as I mentioned previously. Some of the patients also, they can discontinue the drugs without medical advice. They also can use the medication from previous illnesses. So if they have, for example, cold the last year, they would be using the same antibiotic again if they have a cold or sinusitis or something. Also, the sharing of medication is something that is very, very common among all. Let's talk about some of the potential adverse effects of drugs in older adults and how they can interact with some of the herbs. For example, angelica can cause a rash when the person is exposed to sunlight. Garlic, for example, which is very much commonly used in our Omani culture, can have an anticoagulation effect, so it can augment the anticoagulation effect. It can cause also hypotension. It can also increase the effect of anti-diabetic agents. Ginseng, which is also a herbal medication, can elevate the blood pressure. It can cause also insomnia. Ginkgo biloba, which is one of the herbs also, and ginkgo is بالعماني دنجو, and it can increase the effect of anticoagulation. It can cause irritability and restlessness, nausea, vomiting, insomnia, diarrhea. It can amplify also the anticoagulation effect of warfarin. So warfarin have to be taken now with analgesics, for example, let's say aspirin. Aspirin can cause iron deficiency anemia as a result of GIT bleeding, and this bleeding may or may not appear, so they may not even notice the GIT the bleeding. So that's why we have to be careful, so and to reassess our patients if they are taking aspirin. It can also cause thiamine deficiency. Acetaminophen also lacks anti-inflammatory properties, potential for hepatic necrosis. In addition to antihistamines, for example, the ingestion of larger amounts of alkaline foods, it can interact with antihistamines like milk, cream, almonds, alcohol, for example. It can prolong the action of antihistamines. Short-acting opioids, such as meperidine, morphine, oxycodone, for example, can also interact, and it may not alleviate the mild to moderate pain. In some older adults, it can cause a lot of sleepiness and some other adverse reactions. Okay. Piperidine is the least preferred because it is excreted by the kidney. The risk of toxic reactions to this drug is very high, and that's why we don't use it very often. So very oftenly we use codeine and oxycodone here in Oman. Other examples of medications that we use in older adults, or frequently we use them in older adults, are the long-acting opioids. For example, fentanyl, morphine sustained release, oxycodone again, that is sustained release. Some of the common side effects, and you may know this, including constipation, of course, nausea and vomiting and sedation, lethargy and feeling weak. Acetaminophen is one of the most commonly used medication. It can be used for mild to moderate pain, and it may be used daily in older adults, but we shouldn't exceed the 4,000 milligram per day. And it shouldn't be used in those people who have liver disease. So for aspirin, because aspirin can increase the effect of oral anticoagulants or oral antidiabetic, cortisone-like drugs, penicillin and phenytoin, we need to know this. So if any adverse reaction happens, we should know that aspirin may be the cause. Also, aspirin's effect can be increased by large doses of vitamin C. So if the patient is taking aspirin and vitamin C at the same time, the effect of aspirin can increase, so bleeding can happen. And also it can be decreased by antacids and phenobarbital or propranolol and risperidone. Acetaminophen's effects can be decreased by phenobarbitals, and meperidine can decrease the effect of eye drops, for example, used for the treatment for glaucoma. Now, anti-anxiety drugs are not very much common here in Oman, but we do see some of the older adults taking them, especially to induce sleep. They can be also used in the diagnostic and statistical, in the diagnostic, in the some of the mental disorders, especially in anxiety, such as short-acting benzodiazepines like alprazolam, istazolam, lorazepam, oxazepam, and temazepam. Some of the long-acting benzodiazepines, such as chlorodiazepixide and clonazepam, diazepam, again, if they are coated, and flurazepam and quazazepam. The side effects of benzodiazepines are a lot. That's why prolonged use of these medications are not very much recommended. And it includes addiction, drowsiness, confusion, dizziness, unsteady gait, and slurred speech, and of course confusion. Less commonly, of course, the patient can have abdominal or stomach cramps, and after stopping the medications, it can induce irritability and nervousness in addition to insomnia, of course. So our nursing guidelines for anxiolytics is to advise patients to change positions slowly and to avoid operating, for example, a car or machinery, because it can affect, it has some cognitive effects. Also, it causes constipation. That's why we need to ask the patient to monitor their bowel elimination and increase fiber in their diet. In addition to monitor the nutritional status and the weight, to assure food intake is not jeopardized by possible lethargy or GI upset. So if the patient is having a lot of GI upset, they tend not to eat any food, which can cause them some of the nutritional status, of course, will be affected. So for anticoagulants, of course, we need to be careful because they have narrow treatment range and they have high risk for bleeding. So one example is heparin, another example is comadine. For example, these are the two most commonly used. Our nursing guideline or our nursing consideration is to make sure that the patient gets foods that are rich in vitamin K, like cabbage, green leafy vegetables, and to avoid them because they can reduce the effect of anticoagulants. Another class of medication is antidepressants, or what we call SSRIs. They tend to be well tolerated and effective for older adults. However, they have multiple side effects. So these tricyclic antidepressants can cause, of course, orthostatic hypotension. It can cause a lot of anticholinergic effects, arrhythmias, for example, especially in those patients who are already having disorders. Antipsychotics are one of the common medications used in older adults. We use them to treat delirium, agitation, or psychosis, or even patients who are having Alzheimer's or schizophrenia. They can improve quality of life, of course, and the function of an older adult. However, they have profound adverse effects, very huge adverse effects. The two major classifications, the first and second generation, what we call them generations, in our nursing consideration or guideline for these antipsychotics needs to include uh, multiple points. First, that older adults are more sensitive to these medications. Okay. The second thing, all patients may include, for example, it may include tardive dyskinesia, Parkinsonism, akinesia, or dystonia. So they can have what we call an extrapyramidal effect. Also, older adults who receive these antipsychotic medications are at high risk for, again, anticholinergic and pyramidal effects of this classification of medication. So here is the adverse effects of these antipsychotics, or the CNS adverse effects for antipsychotic, and the incidence for each one of them. When we talk about sedatives or hypnotics, we use them for insomnia, nocturnal restlessness, for example, at night, and anxiety and confusion. These medications such as flurazepam, hydroxyzine, quazepam, and triazolam these drugs are not drugs of choice for older adults because they are very much heavy drugs and can have a lot of adverse effects. Okay, so the adverse effects of sedatives usually include tolerance, reduced tolerance after prolonged use, or they can have a lot of tolerance after prolonged use, so it wouldn't affect them. The sudden discontinuation of the medication may cause restlessness, insomnia, and nightmares even. Other common medications or class are cholesterol-lowering drugs. It increases the use of cholesterol. There is an increase of use of cholesterol-lowering drugs based on the newly published guidelines to prevent cardiovascular disorders and improve quality of life. So, an examples of or types of cholesterol-lowering drugs, and they're such as simvastatin, for example. And these medications can impact the liver function. It can also cause muscle pain or myopathy and breakdown of skeletal muscles, of course, so there will be atrophy of the muscles. And here I wanted to talk also about digoxin, because digoxin is one of the very important medication that we are using in patients with supraventricular tachycardia, those with congestive heart failure or atrial fibrillation even. And it can cause toxicity, so it's very important for us as nurses to be alert, because its effect also can be increased by benzodiazepines, erythromycin or ibuprofen, and phenytoin even. It can, the effect can be decreased by antacids and laxatives and even phenobarbital medications. There is a high risk, as I mentioned, for toxicity, and that's why we need to monitor the toxin. Practice question for you. A 65 years old patient was recently started on hypnotic medication triazolam for treatment of insomnia. The nurse should know that this patient is at increased risk of which complication resulting from adverse effects of the medication. Of course, false. So we have false constipation, incontinence, or hypertension, and it actually can cause hypotension. So the answer is